Welcome back to Ozarks Fox AM. We're joined now by Dr. Kristen Thompson and Dr. Tamara Fusco from the Burrell Behavioral Health Center. And we're so glad that you're here because you're going to be talking about a new youth-focused clinic for ADHD, which is a huge deal in our country right now.
You know, it is a huge deal. If you, depending on what study you look at, between 6 and 8% of all children have ADHD. So at Burrell, we're doing a new clinic. It's multidisciplinary. We have our psychology piece for accurate diagnosis because we really want to rule in what is ADHD versus what is not. We have our therapy piece and we have our medical piece. And that combination gives us comprehensive care, which the studies have shown give the best rate of success for children with ADHD. So we're very excited because there's nowhere else in this area that has such a comprehensive multidisciplinary clinic for treating children with ADHD.
So you're dealing with the psychological and you're dealing with also medical.
Absolutely, because you know, they're really not separate. They go hand in hand. And what we know is, like I said, first of all, we want an accurate diagnosis. Not everything that presents with symptoms of ADHD is ADHD. We want to make sure that if we have a child with trauma and behaviors that are related to that, that we get them appropriate care and we don't put them on a stimulant medicine. For the children with ADHD, we want to give social skills, problem skills therapy. We want the parents to have those tips and behavioral therapy so they can best manage the child. And of course, being the medical doctor, we know that the medicines are extremely effective if they are appropriately administered.
Right. Dr. Kristen, when diagnosing this, where do you look to first? Do you look to the mental side or do you look at the physical side, or is it something you need to look at the same time?
You know, ADHD is really a diagnosis that you look at, you can see the symptoms, but like Dr. Fusco said, we're trying to figure out, are there other places those symptoms could be coming from? Is there trauma in the family? Are there differences in how their brain functions in terms of like their working memory or how fast they process things? So there are a variety of things we do when we do an assessment to get a good history about the family, understand what's happened in that child's life, and then also understand more about how their brain works through different assessments so we can really have a better idea of A, what is this? And B, even within ADHD, there's a big continuum of what that looks like, and so where are their strengths, where are their weaknesses, and how can we help prop up their functioning based on those things.
I'm just really interested. Can you break down, what are the physical tests that you do?
So the physical tests are actually more, it's not a diagnosis where I examine a body and am able to say you have ADHD. It really is more symptomatic, like what we're talking about. Now when we prescribe the medicines, we are looking for physical types of things because we know the medicines are serious medicines, but we take them seriously and we're going to monitor them very closely. So I'll be looking for things like blood pressure, weight loss. I'll be doing a thorough cardiac exam to make sure that there's not any contraindications for medicine, that type of thing.
I gotcha. And now talk about the clinic that's coming up and how do people get involved if they're worried about their child?
Absolutely. So we just opened last week. We
are
so
brand new.
Pleased to finally be in our space and offering services.
That's great.
You know, Burrell has a wide array of services, and you can refer to our clinic just by calling Burrell. They have that main number now that you can call and just say you're interested in the youth-focused clinic to get services for ADHD.
Do we know, why do we think that we're seeing this more often now?
It's that's a multi-answer question. Some people would say that we're just better at diagnosing it with it, and I think that's probably the most common answer that we hear is that maybe we're better at diagnosing it. In the past, we may say, "Oh, they're just being a boy," or you know, that's just, you know, they've always been active. They're just, you know, they're going to grow out of that. And so I think that now we're seeing that these are actually obstacles to success for children, and we want to remove those obstacles because what we find is if we identify children, we treat them, they don't go on to that low self-esteem, thinking, I'm stupid, I can't be successful. When you have the low self-esteem, we also see anxiety and depression in children with ADHD. So like I said, our goal is early detection, appropriate care, and really making these children successful.
And is this something that you would deal with lifelong? So if the child has this, is this a lifelong thing? Or do you, like you said, you know how people say, you'll grow out of it. Do you eventually grow out of it?
ADHD as the condition is not something that goes away. However, people often grow into their symptoms. You know, they learn ways of managing it. They learn tips and tricks for how to function better in their day-to-day. And sometimes people choose careers that really support their functioning better.
All right.
So I think
you got to
they grow
give them
into
a
it.
call. Ozarks Fox AM will be right back.